And we have a very exciting webinar today. We will be hearing from speakers from the National LGBT Cancer Network. We're so excited to have all of you join us today for this presentation. And I do want to let you know, I'm Gina Roberts. I am the lead coordinator, regional coordinator for the Tobacco Control Program, and I cover the Southwest of Virginia. We also have our other 4 coordinators on the call, as we usually do every month. Sarah from the Central Region, Nicole from the Eastern Region, Carrie from the Northern Region, and Tiffany from the Northwest Region. And we're here really because we want to support you in whatever tobacco control activities you're doing out there. So know your regional coordinators and contact us at any time. Okay, so we're going to go ahead and start with, there's a chat and a Q&A box, and Nicole works the chat very well. Thank you, Nicole, for all you do there. If you have chat, please put it in the chat box. If you have questions, we will take questions at the end, so please put those in the Q&A box as well. So we're going to do what's the tea with tobacco, a question that we always do each of our webinars to see just where you are in your community. How does your community support LGBTQ+ individuals? And this is multiple choice, so please select as many as you want. Do you do trainings on inclusive language on gender and sexuality? Do you collect data on health disparities among LGBTQ+ individuals? Do you have dedicated staff focused on work supporting LGBTQ+ population? Do you have tailored materials designated for the LGBTQ+ individuals? And do you have signs on your doors welcoming all? And again, we just want to get a feel on what you're doing in your organization right now currently. So we'll keep it up a couple more seconds, and then Sarah does our polls each month. Thank you, Sarah, for that too. We really do have a great team. So invite people to join each month. Okay, let's see what everyone chose. Okay, very good. Trainings and collect data are your top 2. So there's still some ways that we can really improve on what we're doing in our community organizations. And hopefully with our speakers today, we will learn more about how we can join in and participate. So I have the pleasure of introducing today our 3 speakers, and thank you so much for joining us. We have Knoll Larkin. He's the project manager at the National LGBT Cancer Network and oversees our CDC-funded national network to advance commercial tobacco use prevention and cancer prevention in LGBTQ+ communities. For the past 18 years, Knoll has worked as project director, manager, and research associate on cancer research studies and community-based initiatives. Welcome, Knoll. We also have Bryce Moore. He's a project specialist at the National LGBT Network. He provides technical assistance, training, and support for the Networking to Save program and leads special projects. Oh, and I love this one. In 2016, Bryce was named the National Youth Advocate of the Year by the Campaign for Tobacco-Free Kids. He has spent the past decade working with organizations like the Campaign for Tobacco-Free Kids, the Truth Initiative, and the Partnership for a Healthy Mississippi. Welcome, Bryce. And last, we have Harold Abrams. He's a project specialist with the National LGBT Cancer Network, who supports technical assistance and engagement activities, including support groups for people on the cancer journey. Harold recently oversaw the development and launch of Frankly, the network's Sex After Cancer microsite. So thank you again, all of you, for joining us today. We look forward to your presentation and really look forward to how we can help partner with you. So I'm going to turn it over, Bryce, to you, and we will get started. Thank you again.
Awesome. Thank you so much, Gina. Well, we are thrilled and excited and fired up to be here, and we hope that you are too. This is going to be a good training today. We are going to really focus on really talking about the intersection of tobacco control and LGBTQ+ communities. I think Gina already did a fantastic introduction, so we'll go ahead and get right into our agenda. We're going to first just introduce you to what the great work that we do at the network. And then we're going to kind of get into a little bit of cultural competency, kind of talking about things like the importance of pronouns, the difference between sexual orientation and gender identity. And then we're going to talk about some of those disparities within the LGBTQ plus community before finally diving into our tobacco section. Where we'll look at things like stats, we will look at things like the targeting that has gone on within our community. And then we can't talk about anything related to health equity without talking about the intersectionality piece. And so we will talk about the intersectionality of culture, race, and LGBTQ plus targeting. And then finally, we'll kind of end with talking about some action items and best practices before letting you know a few things, a few exciting webinars and things that we have going on at the network and ways that you can get involved. Go to the next slide. So I'm going to now turn it over to Knoll, who's going to get us started.
All right. So one copy before I get started, I know many of you can relate. I have 2 of my 3 kids home with me today who are sick. So they are all watching TV, but hopefully won't have too many interruptions. So thanks for your patience. So again, my name is Knoll Larkin, project manager at the National LGBT Cancer Network. And thank you, Bryce, for that framing. Just to kind of give you a few minutes intro to our organization, we're focused in 3 major areas: education, advocacy, and training. We educate our LGBTQ communities about cancer risk, the importance of screenings, and we're also doing more support. So we have one of the only LGBTQ specific cancer survivor support groups running virtually right now in the country, we think. We do a lot of advocacy, so for engagement in mainstream cancer organizations, advocacy around data collection, particularly around tobacco use and data collection for LGBTQ organizations. And of course, we do a lot of training and technical assistance for public health organizations, state tobacco control programs, cancer centers, all kinds of folks. Just really anyone who's working on being more inclusive and doing work with LGBTQ communities around tobacco and cancer. So we are, and this was mentioned in the intro, one of 8 disparity networks funded by the CDC. We, again, work with state cancer and tobacco programs, assessing knowledge gaps, offering trainings and technical assistance, creating knowledge pieces that we disseminate. We do a lot to work with states and some on our own to create targeted media, mass media campaigns that we can replicate and co-brand so other states can use them, and then building partnerships and connections. We have a 400 member organization, 400 network organizations that we work with to support the work they're doing and to foster that network. Just a few quick things. We have newsletters. So if you are interested in joining or signing up for our newsletter and you're already not receiving it, feel free to drop your name and email in the chat and we can add you to our newsletter list. You can find out about all kinds of things coming up. We send out information about our upcoming events and also resources related to the LGBT community focused on tobacco and cancer. We also have a pretty extensive online resource library. So anything that we create, any new information, often webinars, we'll record and post here. So we have presentations, infographics, media. It's a great place to kind of dig around and see what's been done. We also try to post the work of other states, particularly around tobacco and cancer. So if someone did a really cool education campaign with permission, we'll post it here as well. So it's a great place to go digging for resources. Again, we have a pitch. We'd love for folks to join our network. Again, we just said join our as a newsletter, but if you'd like to do more with us, get free training and technical assistance, connect with local organizations, like if you need help connecting with a local LGBTQ organization, if you want access to tailored media and any really specialized help, it's free, and we strongly encourage you to join our network. Feel free to message us or drop your interest in the chat, and we can also follow up with you there. Okay, so I just want to take a few minutes. I know Bryce mentioned that everyone starts at a different place. So we want to do a little bit of level setting around terms just to make sure people are all on the same page. So when we're throwing things around like LGBTQ, people know what that means. So I'm just going to take a few quick minutes to provide some definitions. Just as a caveat, we always say Google is free. And so we strongly encourage people to do their own searching and digging. Also to say that language is always changing. And as you know, back when I used to do these trainings 10, 15 years ago, we used to spend a lot of time on terms and definitions. And now even in our intro, our 101, so much of what we help people understand is how to ask people questions and how to understand broad categories. But language is changing, people and communities are changing. So we can't cover everything. But just to kind of put out there, these are a few. So you hear the word LGBTQ, LGBTQ+, LGBTQI. These are all umbrella terms that encompass different subsets. So sexual orientation, gender identity, and someone's intersex status. So I'll talk about what these three things mean, but there's no right or wrong term. We actually, as an organization right now, are using LGBTQ+ most frequently. That covers lesbian, gay, bisexual, transgender, queer, and then the plus is a bunch of other identities, which we weren't going to spend a ton of time on today, but I can direct you to some resources like intersex, asexual, non-binary, and things like that. So the plus just means there are other identities and other letters that are not represented. So what is sexual orientation? Most of us are probably familiar with this. We all have a sexual orientation, even if it is straight or heterosexual. So this is just someone's emotional, romantic, or sexual attraction to other people. We want people to know that all people choose their partners, regardless of their sexual orientation. So someone may identify as a lesbian, but may choose to partner or date men. But we want people to understand the orientation itself is not a choice, but how the decisions people make to date and partner with, that may be a choice. So we hear under this sexual orientation with lesbian, gay, bisexual. Those are some terms that we often hear. Again, just to kind of briefly touch on gender identity. So just like everyone has a sexual orientation, everyone also has a gender identity. So this is one's concept of innermost concept, how you feel inside related to your gender, seeing yourself as male, female, maybe a blend of both or neither. So your gender identity can be the same or different than the sex you were assigned at birth. So for people, for many folks, you may have heard the term cisgender. This is someone's gender identity that is aligned with the sex they were born at birth. So let's say you were born or assigned female at birth and you identify as a woman. So we would actually consider you cisgender. Conversely, if someone was born male and they, or assigned male at birth and they identify as a woman, then we typically put them under the transgender umbrella or someone of a transgender experience. So just in summary, it's sort of a persistent internal sense of being a man, woman, or some other gender. The other thing we want to talk a little bit about, and this comes in when we talk about the non-binary community. So a lot of people may be hearing this term more and more. So this is basically someone who's non-binary might exist outside of the sex or gender binary. So either being neither man nor woman, or feeling like both. So this comes in when we talk about pronouns. So you'll see a lot of us, like myself and probably Harold and Bryce, and some of you maybe, though I can't see, may have listed your pronouns like he, she, or they in your Zoom names. So increasingly we're seeing people using gender neutral pronouns. They, them is often the most common. And we are encouraging people to really get more comfortable with asking people about their pronouns. If you're unsure of what pronouns people use, we want you to ask. We often say one example to kind of break the ice or start that conversation is, hi, I'm Knoll. I use he, him pronouns. What pronouns do you use? So again, people make mistakes, but we want to urge people to apologize and move on. Don't make a huge deal. Thank the individual for the correction and quickly move on. So the other thing just to show as an example, and we'll get into a few things later that Bryce will talk about, but like ways to show that you are a welcoming individual or a safe organization is to include your pronouns in an email signature. So this is just one example of how you can put, so this is Josh Hudson from the Bay Mills Health Center, and just kind of showing pronouns he, him, and they, them. So this individual uses both he, him pronouns and they, them pronouns. And he has a link here that someone who didn't know much about pronouns could go and look and see what that means. So I'm just gonna, again, these sections are a quick little overview. Please feel free if you have questions to drop them in the chat. We do have a couple links we can share that are further collections of terms and definitions for people who might want to do more background reading and to better understand LGBTQ communities. So we'll talk a little bit about demographics. And the big takeaway message here is there are increasing numbers of people identifying as LGBTQ plus in the United States. This is a Gallup poll that was just released in 2021. And you can see now that 7.1% of folks in the United States are identifying as LGB or T. So those numbers are greatly increasing. And kind of the takeaway here is if you're not addressing or including LGBTQ communities in the work that you're doing, you're going to be, you're going to be left behind and you're not going to be relevant and meeting the needs of your community. So we really want folks to see that those demographics are quickly changing. And this is just from 2012. So this is just, 10, 12 years. The other important thing we want people to understand that LGBTQ communities have a much higher percentage of people of color, BIPOC folks in them than general or non-LGBTQ communities. So 24% of general population are racial and ethnic minorities, but in the LGBTQ community, 42% of LGBTQ folks are racial or ethnic minorities. So that's a larger percentage of people that are BIPOC that identify as LGBT or Q. Again, another reason why when we do this work or want to be inclusive, we have to really think about those intersections between race and sexual orientation and gender identity. Just a couple more slides about LGBTQ youth. So these numbers are growing, and we know in the last couple of years that 1 out of 4 LGBTQ youth identify as non-binary. So that's 25% of the youth that you could be working with or seeing are identifying as non-binary. So those are huge numbers. And so just to stress the importance of when you're thinking about working with youth, that needing to understand and work and include non-binary youth experience is super important. And then 1 out of 3, even higher, LGBTQ Black youth identify as non-binary or transgender. And then a couple more slides. So what about Virginia? We always try to pull some stats. So just to kind of help you kind of conceptualize, well, how many LGBTQ people are there in Virginia? So these numbers are from 2020, I'm pretty sure, but there's 257,000 LGBTQ folks in Virginia. So that's approximately the size of Chesapeake plus another 18,000 people. So when you're thinking about serving the community, we're just trying to conceptualize the size a little bit. And one last slide in my section here is, what about Virginia? Well, it looks like your stats align very closely to the national average of LGBTQ folks who are racial and ethnic minorities. So 42% of the queer trans folks in Virginia are racial and ethnic minorities, versus when you look at all people in Virginia, only about 31% are racial and ethnic minorities. Somebody pointed out or reminded me before we started, so you'll see this word folks with an X, and you may see this in other language. So this is an attempt, or how language is changing, you'll see an X added to some things. Instead of like Latino or Latina, you see Latinx. So here, instead of folks, we see folks with an X. This is really just to be more inclusive to members of the LGBTQ community that are non-binary or that do not fit into male or female categories. So that's just something that the community is doing. So you may see that that X in other areas as well. But feel free to drop any questions in the chat as they come up around terminology or language. And as Bryce is carrying on with the presentation, Harold and I can always jump in and answer some of those. So I'm going to, did I miss? Oh, I missed a slide. I'm sorry. So one more thing I'm going to talk about is we have all this great energy. We're seeing more people identify as LGBTQ. And at the same time, we do know that there's these unprecedented legislative attacks. So anti-trans bills, anti-gay bills all over the country right now. In fact, 2021 was one of the worst years on record for some of these anti-trans and gay legislation. So we have progress. At the same time, we have a large backlash. So that's something to keep in mind that, you know, for example, we know that stress and discrimination is a huge contributing factor to the way to stress and minority stress, and contributes to LGBTQ folks using tobacco as a coping mechanism. So we say all that just to kind of frame the current situation. And I think now I can safely turn it over to Bryce to talk more about targeting and tobacco in LGBTQ communities.
Awesome. Thank you so much, Knoll. Yeah, so we are going to dive into our tobacco section now. Knoll did a really great job of kind of setting up the framing, especially kind of talking about, you know, some of those numbers, talking about some disparities, talking about some cultural competency stuff. And now we're going to really get into the meat of this and kind of start first talking about tobacco targeting. And so we have to start, and you go to the next slide. We have to start with back in 1970, the tobacco industry really wanted to heavily market to the queer community. But the problem was that tobacco companies were actually giving donations to anti-LGBT politicians who were mostly from southern states where the tobacco companies were headquartered. And so ACT UP, which is an HIV and AIDS advocacy group, they actually called for a worldwide boycott on all Philip Morris products, including Marlboro cigarettes in 1990. You go to the next slide. We always talk about Project Scum. In 1995, the tobacco company R.J. Reynolds actually created a marketing strategy that was targeted towards gay men and homeless people through advertisements and displays that were placed in communities and stores. And the whole goal was to boost the sale of cigarettes, but they called it Project Scum, which stood for Subculture Urban Marketing. And it really, you know, showed what the tobacco companies think about our communities. It really showed that they were explicitly trying to target us. And so we always have to talk about that because we like to talk about the history and like to show what the tobacco companies have been, right? But we're also going to talk about what they continue to do and what they are today. Going to the next slide, talking about specifically menthol advertising. So much pushing of menthol products has been so popular that many of the queer advertisements are actually menthol specific. And so many of the ads really show a lot of stereotypical ways of kind of being coded as LGBT, like rainbows or the two shirtless men with their dog in the ocean. And you go to the next slide. Just kind of continuing to show some of these ads. You know, not much has changed even with electronic cigarettes and with smokeless tobacco products. Many companies still sponsor, many of the tobacco companies still sponsor pride events or they host other queer community events to really get people introduced to their products. And so not much has changed, you know. I mean, they might not be explicitly calling us scum, but they are still finding ways to target and market to our community. And they do that through a variety of ways, including using queer culture. And so you can go to the next slide. So this is an email that we got about a year ago in May of 2021. And this shows that the tobacco companies, they are really heavily using influencers and, like I said, queer culture to really try and stay relevant and to really market their products to our community. They want to show that they are, that they understand us, that they stand with us. But you can't stand with us if, you consistently target your products towards us, and your products, when used as intended, can harm or even kill us. And so that's not that's not anything that's going to be positive for our community. You can go to the next slide. So even if you're not seeing explicit ads with rainbows and very queer specific images, tobacco companies, like I said, they're still within our community events. In June of 2021, we got this email about an LGBT advocacy event that was taking place. And so when we looked at the fine print and we looked at, okay, who are the sponsors of this event, we actually saw that Philip Morris International was actually sponsoring this event. And so, like I said, the tobacco industry, they are still heavily trying to infiltrate our community, trying to really show that they are, for our community, while they're continuing to do things like pass out free products or sponsor our prides. You can go to the next slide. So really kind of talking a little more about this is the last slide that I'll kind of talk about the marketing and the influence. So many tobacco companies, like I was saying, really advertise at a lot of our pride events and a lot of our pride festivals. And they also contribute to local and national LGBT and HIV and AIDS organizations, right? They learned their lesson from the 90s. They're like, okay, we gotta flip the script and we gotta start really donating to HIV and AIDS organizations. But again, they're still marketing their products to our community. Tobacco advertisements in gay and lesbian publications often really depict tobacco use as a normal part of queer life. I mean, it's something that I think so many of us as queer folks, we see it growing up. We see it as we're, coming into our own, that tobacco use is really, so ingrained within our community. And the tobacco industry really heavily encouraged menthol cigarettes among the LGBTQ plus populations. Approximately 36% of LGBT smokers actually report smoking menthol cigarettes. And so we are, the tobacco industry, their targeting, has unfortunately led to so many folks being able to, use these menthol cigarettes. You can go to the next slide. Now we're going to kind of get into some of the numbers. So now you've seen the targeting, we've covered the history, we've talked about how the tobacco industries, they may have changed their products, but their strategies are still the same. So now we're going to look at how that has affected our community by the numbers. You can go to the next slide. So we know that as a community, LGBTQ plus folks smoke more than the general population. We also use menthol products more than non-LGBT people. We know that the tobacco industry has heavily targeted the Black community with menthol products, and they've also targeted the LGBTQ plus community as well. We also know that as a community, we see more tobacco ads than non-LGBTQ plus people, especially, on social media. We know that we're exposed to secondhand smoke more than non-LGBTQ plus people as well. You can go to the next slide. So we always have to talk about this piece on intersectionality. I mean, it's so important. As a community, LGBTQ plus folks, we know that we, like I said, smoke more than the general population. We use menthol products more than non-LGBT people. But when we start to look at the intersections, we see that there are higher usage rates, especially when we look at the intersection of different cultural communities, different racial and ethnic communities. And so Latinx populations actually have the second highest menthol usage rates. Black communities have the first. We know that gay Black men face greater smoking-related health risk than members of other racial groups. Gay Black men also experience the greatest rates of tobacco-related cancers or deaths. 70% of LGBTQ plus youth who smoke prefer menthol. Again, not surprising considering how heavily the tobacco industry has really marketed their menthol products specifically. Although many people think that vaping is, this huge problem for, just youth in general, or especially white youth. When we look at, queer youth who live at the intersection of marginalized identities, we find that the rates of vaping are typically higher. And so Black trans youth are also more likely to vape than Black cis youth. Asian trans youth are 3.5 times more likely to vape than cis Asian youth. So you can go to the next slide. Continuing continuing to talk about intersectionality, now to kind of look at gender. This is from Rutgers University data in July of 2021. So, about a year old. And it shows that 54% of bisexual women who smoke prefer menthol products, and 50% of lesbian or gay women who smoke prefer menthol products. And again, this is not surprising because a lot of ads are really heavily marketed to our community and therefore menthol products. You can go to the next slide. So really kind of continuing to talk about vaping. We know vaping has been a huge issue, especially among youth. The levels of vaping have exploded. My mom is a high school teacher. She tells me all the time, like now her school is having to install smoke, different smoke detectors and, all of these strategies to really try and combat youth vaping usage. And, this is really true, not just for youth, but especially for queer youth who we know are using electronic vapor products at a very high rate. And there's also increasing evidence that youth vaping could lead to youth smoking cigarettes or smoking both e-cigarettes and cigarettes. We call that dual use. You can go to the next slide. So when we talk about queer health, we know that so much of it is focused on HIV, it's focused on mental health, which it absolutely makes sense why that is, right? But unfortunately, there's a real lack of understanding that tobacco use is not just something that our community struggles with, but it is something that is continuing to take our lives. It's a huge health issue for our community, and it's really important that we focus on it when we are talking about, the health and the safety of LGBTQ plus communities. We know that so many smokers actually began using tobacco products before the age of 18, and oftentimes that ends up correlating with around like 12 or 13 is when we begin to see so many youth begin trying tobacco products, using tobacco products. Oftentimes that also tends to be the age where most youth are now starting to come out, and so there's starting to become a correlation. And you go to the next slide. So kind of talking now about the tobacco use within trans communities. So many of our trans tobacco stats that we have are pretty old, like 6 years old. And oftentimes gender identity questions are just not asked on various surveys and studies. Several studies have found just varying numbers of usage rates, but here's what we do know. We do know that trans communities have higher smoking rates, and I really want to underscore this point about collecting our data. It's so important to do this, and it's so important to collect data specifically about the LGBTQ plus community so that we know how to really create programming about cessation, about usage rates. It's so important. The trans population is really considered especially vulnerable due to high rates of substance abuse, depression, HIV infection, and a lot of social and employment discrimination. And all of these, according to studies, have seem to link or be associated with a higher smoking usage rate. And so unfortunately, and we have to talk about this, many trans folks in the US don't have health insurance. And that's due to a variety of factors like discrimination or not having a job that offers it. And so this also increases tobacco usage rates in the community, and it stops folks from being able to get cessation specific materials and support. You can go to the next slide. So this is a really interesting stat here, but it shows that the more discrimination that a person experiences, the more likely they are to prefer menthol or use menthol products. Very interesting, right? When we've just talked about and seen kind of, the menthol usage rates by the numbers, right? And now to see that we have this stat about the more discrimination someone experiences, the more likely they are to prefer and use menthol related products. You can go to the next slide. So I myself am a poet. I'm an artist, and I think I can talk about data all day long, right? And I'm totally here for that, right? But I think and believe that there is nothing more powerful than people's stories. And so that's why I love our Out Proud Free campaign, which really delves into, stories from, our community members in the LGBTQ plus community. And we really get to hear about their experiences using tobacco, how they've seen it show up within our community. And so I'm gonna go through a few of those stories and just highlight them. The first comes from Marion. Marion currently works in tobacco control. I used to be heavily involved in ACT UP, the AIDS Coalition to Unleash Power. And our story really highlights the impact of smoking when others in our lives are smoking. Marion from Florida says, I started smoking when I was 17 because my roommate smokes Cools and I thought she was cute. I smoked for the next 20 years. Wow. You can go to the next slide. So this is one of my friends, Xavier, and Xavier says, as an Afro-Indigenous Caribbean person who identifies as queer, tobacco products have invaded our spaces. Xavier's from Georgia. And so really going back to how tobacco companies really sponsor so many of our community events, in the queer community, these products really seem to be everywhere, like I said. And so those who live and exist at the intersection of multiple marginalized identities really tend to feel suffocated or bombarded by tobacco's presence. You can go to the next slide. And this is also, this is a really powerful quote from another one of my good friends, Sam, who lives in New York. And she says, I'm not cutting anymore, but I switched to smoking, which essentially did the same thing. And so Sam's story really highlights the intersection of tobacco use and mental health. Many LGBTQ plus people who don't have access to mental health care, and that's because unfortunately in this country, we've done a really good job of separating mental health care from other forms of health care. And so if you are an uninsured, queer, youth or young person, and you have to decide whether you're going to spend, all of this money on a 45-minute therapy session out of pocket, or if you're just going to spend a few bucks on a pack of cigarettes or some kind of a tobacco product that might temporarily take the edge off. A lot of people are going to probably choose the tobacco product. And so the impact of mental health on tobacco rates is absolutely something that we have to consider and talk about. Next slide. So we have our best and promising practices that you can find on our website. This really just kind of highlights, so many great action items and steps that we would recommend, for folks to take as they're doing work within our communities, how they can remain and if they're not already, really ensure that their communities, their coalitions, their work is LGBTQ+ inclusive and welcoming. You can go to the next slide. So these best and promising practices section, I'm going to kind of breeze through this, but I do want to kind of highlight a few things. Number one, it's really, really, really important, especially when you're talking about the LGBTQ+ community, that you, number one, understand that it is not our number one health issue, right? We hear that anecdotally, we hear that from the data, right? And so it's important to really start from a place of health equity. Tobacco use is not an equal opportunity killer. We know that smoking disproportionately affects BIPOC, LGBTQ+ communities, low-income communities, etc. And so LGBTQ+ communities consistently, like I said, rank tobacco use and smoking as a low priority. And so it's really great to begin addressing those social determinants of health, start from that place of health equity, and also really, really good to really talk about community engagement, really making sure that we're building support for tobacco control in queer communities, really making sure that when we do that, we have some kind of solutions, right? And that we're not, that we're making sure that, with these solutions and, ways that we're addressing barriers, that we're including queer communities. You can go to the next slide. So kind of breezing through these, when you're trying to create an LGBTQ+ welcoming environment, so really, really, really great idea to. Oh, I think we're having some slide difficulty, so let me stop.
I'm sorry, everyone.
You're good. But while Knoll is doing that, I'm going to go ahead and keep on talking about the systems and practices slide. And so great, we got it up. And so when you're trying to create an LGBTQ+ welcoming environment, it's really great to start by creating some kind of LGBTQ+ advisory committee. No one is going to know your organization like your staff. And so, it's a really great idea to begin thinking about, hey, maybe creating some kind of advisory committee. And so, or really kind of, polling, queer folks within your staff or within your organization. In 27 states, we know there are no explicit statewide laws that are able to protect all people from discrimination on the basis of sexual orientation or gender identity in employment, in housing, and public accommodations. And so this training is not enough. You should always be requiring, queer cultural competency training for everyone within your organization. It's not a one and done thing. As Knoll said, terms are always changing. terms are always changing. People are always changing, and a lot of the times the words that we use to describe our identity and that we feel best expresses who we are just going to continue to evolve with time. And so you have to keep this flow of learning going within your organizations. And then even beyond your organizations, really looking at community and setting up some kind of community advisory committee is really a good idea. If you are working on building like, specifically tobacco control coalitions, are you making sure that you're intentionally including LGBTQ plus community members? And another great thing is partnerships. You can do so much with partnerships, whether that's create joint pamphlets together, create health fairs together. We know that we have heard it from our community members time and time again on surveys, anecdotally, that we love to see ourselves reflected in tailored material, right? We love to see ourselves be represented. And finally, if any financial help that or support that you can provide to LGBTQ plus organizations is always appreciated. Oftentimes, LGBTQ plus organizations really struggle to get funding. And so, of course, if you're using a queer organization services, you should always pay them. You can go to the next slide. Just kind of finishing up on the systems and practices. This next one is a huge point that we like to emphasize at the network. It's one I've already mentioned before, right? But I'm going to say it again because it's just that important. Please collect our data. Please ask us who we are in surveys. That's the only way we're going to be able to draw specific conclusions. It's just the best way that we're going to be able to create and market resources to our communities most at risk. And also, like I said, distributing that tailored material is really great. When you collect data and information that's specific to our community and you use it on research, please give it back to the community. It's very inequitable if you're just collecting data and you're not sharing that data back to the community. And it's also a great way to build trust. Then you go to the next slide. So these last two slides are about developing authentic partnerships. Like I said, this training is not a one-stop for everything, right? We covered a lot, but there's so much more. Partnerships really help both you, your organization, your coalitions, to really learn more about our community, the LGBTQ plus community, and how to do work with our community. Partnerships also really encourage community and allow you to connect with more folks. The LGBTQ plus community, we're a community with a lot of trauma because there's been so much harm done, right, by not just people, but also governments. And so, really spending that time to really cultivate those authentic relationships with queer organizations and people is really taking steps to mend this. So just make sure that you listen to what the community and your partners say they need and want. Oftentimes we do research and we think we have all the solutions based on the data, right? But no one knows how to speak to your community that you were trying to reach. No one knows the history of your community like the people in it and who have done work in it. You can go to the next slide. So really great to, not just asking people to do stuff, but, also providing resources, really identifying ways in which you can, connect with community. Like I said, practice openness and transparency and accountability is also very, very important. You can go to the next slide. That kind of pretty much wraps us up. That brings us to the Q&A section. And so I'm just going to see if there are any, if there are any, questions from the audience. Feel free to drop them in the chat if you have any. Knoll or I or Harold will be happy to answer any questions you have.
Yeah, I thought we could save this time for a little bit of Q&A. And then I know we have those slides with some upcoming webinars. If we have time, we can do those. But I thought since we're short on time, we could open it up. And we'll make sure to send out the slides. Carrie, we'll get them to Carrie and she can send out the slides to everyone.
Hi, this is Nicole with the Tobacco Control Program. Just kind of coming in with we have a few minutes for questions. The main one I think I want to bring up, you just talked about authentic partnerships, and I know Pride Month is coming up in a little bit, and I know it's a great time to kind of start planning that. So what can we do as organizations locally to kind of partner with that? Is it, sharing resources? Are there pamphlets or anything that you would love to provide that we can get off your, resources, things like that? So anything for Pride Month, what do you kind of suggest for us for partnership wise?
I mean, I can jump in and then feel free, Bryce or Harold. I think this year more than any other year is super important to be visible. I think just in the context of everything that we're seeing going on, communities are really, queer and trans communities, I think are really struggling. And so I think sometimes not acknowledging, Pride Month in some ways is almost like complacency a little bit. So I think anything that, I know there's not a lot of time, but we are doing a Pride planning webinar actually this Thursday, and we can share the link. We will record that. So if you can't make that, you can always access that on our website. We can share it to your networks. We're going to talk everything about even like what flags to display, all the way up to some ideas that other organizations have done. So people have, materials people have used, marketing campaigns people have used. We also offer a lot of those as resources, so we can co-brand, you can co-brand things with your organization as well. So we've got a ton of ideas that are going to be shared on that webinar. So I don't know, Bryce or Harold, anything to add there?
Yeah, I did want to add.
Yeah, I can. Oh.
Yeah, but I just wanted to add with Pride Month and everyone kind of gears up, and it's great if you can start some new partnerships and meet new people and have events, but please let that be a launching pad for the whole year. Make sure that you incorporate Pride programming throughout, that you keep the relationships that you're building, that you nurture them and learn from each other, and just keep it going. Let it be a starting place. Let Pride Month be a starting place for you. Thanks.
Yeah, that was pretty much exactly what I was going to say. I think it was perfectly said. Yeah, I also just want to encourage folks, like, I know that June, I mean, especially for our organization, June might as well be tomorrow, because it's right around the corner, and there's a lot that goes into, especially if you are trying to create an in-person Pride, but there are so many options that you can do virtually as well. And really, when you're doing that, really thinking about accessibility, and really thinking about, making sure that, within any kind of event that you are really centering our community is always going to be important.
While we do questions, I'm gonna share my screen again with those webinar info, but feel free to keep the questions going.
Perfect. I think that was
yeah,
great.
and oh, sorry, go ahead.
Oh no, go ahead. Go ahead.
Oh no, I mean, if you have another question, we would love to take it.
Oh, no, I was just going to say thanks and kind of lead it on to Gina to kind of close us up. But if you have one more comment before we do that, feel free.
I was just going to quickly talk about the webinars that we have coming up that we are really, really excited about. I think Knoll already mentioned, of course, about our Planning for Pride webinar, which is going to take place on this Thursday. And so I think Harold just dropped the link in the chat for that. And so feel free to register if you want to learn how you can really engage the queer community, not just during Pride, but throughout the year. Really, really, really great place to do that. And then another event that I am personally excited about because I have been working really hard with our staff on planning is the launch of Outlast Tobacco. And it is our new LGBTQ+ Cessation Quit Line portal. It's designed to really provide that community-specific motivation and encouragement, so that queer folks who use tobacco products, can start, on their quit journeys. And so it's going to be a 1-hour webinar, and it's really going to be talking about, cessation support. You're going to hear from really great panelists. Within that panel, it's going to be folks who have specific stories about their cessation journeys, as well as experts. And you're really going to learn how you can use this resource within your websites, to really kind of target and really kind of market to our community when we talk about cessation. And so I think that should be, Welcoming Spaces. We are so excited that Welcoming Spaces has launched. It's a result of over a year's worth of collaboration between physicians, psychologists, researchers, educators and trainers, patient advocates from across the US. And so it's our new LGBTQ plus cultural humility trainings that are designed for anyone who works within the healthcare system. But honestly, this could really be for anyone who works in public health. And so it was developed in collaboration with the Society of Gynecologic Oncology. The trainings feature 8 free online modules that are each about 45 minutes long, and they're available for CE credits. The first module of training, which provides basic LGBTQ plus introductory terminology, so kind of some of the stuff that Knoll covered, but it goes a little bit more in depth, as well as tools for breaking down assumptions and developing strategies to address harmful interactions, is available now, that first module, and the following modules are going to be released throughout the rest of the year. So we are so excited about it. Like I said, the first session on kind of the terminology and pronouns are available now. So feel free to go and take it. It's completely free. And that's our beautiful and amazing staff that we have at the network. We always love to kind of get feedback on, how we did, what we can improve upon, anything that you would like to see. And so Harold just dropped that evaluation link in the chat. Feel free to fill it out and let us know.
Thank you so much, Bryce.
No, Harold, did I cover everything?
And Harold. Thank you so much to all of you for a wonderful presentation. You have so much information that I think all of us can really use as we really start to do this work in our communities locally. And I think we could have gone an hour and a half, and we really, some topics really need more time. So, but from that, I encourage the organizations that are on this call to really contact you and get these presentations at their own organization so that their employees and their communities can hear as well. So thank you again for the great job that you've done. And we do have a little time for what's the tea. We're going to return to the tea question, and this goes to your call to action. So after the remarkable resources that have just been shown to us, click what you're inspired to do at your organization to put this into your work. And there's a lot of things on here that you can list. So just click all that you think you may be interested in doing. I think you have the contact information so that you can reach out to Knoll, Bryce, and Harold, also at the regional coordinators, as we really bring this to the local communities. So let me click. So take a couple more seconds and click all of those that you think you are inspired to do in the work that you do in your communities. Okay, and then we will see what everyone, because the one reason we do the webinars is really to make sure there is a call to action, to take this information and really bring it to our local communities. Wonderful. This is great. So Knoll, Bryce, and Harold, look at what everybody's planning to do, and I hope everyone reaches out to you. One thing I saw on, I think, Bryce, you were talking about in your resources, the best and promising practices and some systems and practices that we can all put in place. And I think this speaks to that. So we need to take this work and continue it on because it's such an important topic. Thank you all again for joining us today. I do want to just make 2 quick announcements. It is not too late to sign up for the Eliminate Tobacco Use Summit, and that's where we're working to have tobacco-free colleges and universities throughout Virginia. And that summit is coming up this week, tomorrow, Wednesday and Thursday. So I think we'll put the link in the chat box for that. And also on May 17th from 10 to 11, we're having our next webinar, the Tobacco Free Tuesdays webinar, and we're excited to have Dr. Sunny Shin with us. Dr. Shin is an associate professor at VCU, as well as the director of innovation in child and family wellness research. And he's going to be discussing preventing tobacco use among youth exposed to adverse childhood experiences. And I think another great topic of how we can really bring our programs to really reach some of the populations that really need it the most. So I will end the webinar now. I appreciate everyone joining us. Please share the information. We will be sending out all the links to the webinar after this so that you can share. I think I saw at one number we had 42 people on, but let's spread it far and wide so everyone will hear this. Thank you again for everybody. Have a great day. Bye.